I'm a local resident, I'm a local patient, and I also happen to be the chair of the Save Our Hospitals campaign. I want to preface my comments by noting that STPs, Sustainability and Transformation Plans, which are being imposed across the country, are actually about cuts, closures and reorganisations. Every page of the published STP refers directly or indirectly to closing the 1.3 million funding shortfall. That is what is meant by sustainability, cuts by an obfuscating term, to follow on Steve's comments. This STP, like all others, emphasises moving care out of hospitals into the community, but without any evidence that this will work or that such out-of-hospital care will save money. The plans to significantly downgrade Charing Cross, albeit postponed, and Ealing hospitals have not changed, except that it now seems that these hospitals are to become glorified facilities for wrinklies such as myself. I'm sure that others will take up these issues in more detail. What I want to focus on here is consultation and evidence. In September this year, NHS England published a document, Engaging Local People, a guide for local areas developing sustainability and transformation plans. There are a few quotes from this document, which is one reason why I've written out what I wanted to say. I would like to make now. First, it says, public bodies with responsibility for STPs have a variety of legal duties, including to involve the public in the exercise of their statutory functions. Not doing so effectively is likely to cause legal challenge and lengthy delay. We know that the public engagement meetings in Ealing and Brent have essentially been sales jobs, and this seems to be the case here this afternoon. Indeed, a single working day meeting hardly seems to fit the bill for a legal duty to involve the public. I would like this to be noted in the outcomes for this meeting, should we want to pursue the issue. Then, the document says, consultation must take place when the proposal is still at a formative stage. Sufficient reasons must be put forward for the proposal to allow for intelligent consideration and response. Adequate time must be given for consideration and response. Decision makers must properly consider the material produced by the consultation. Reading the STP, and for my sins, I have read it several times, a great cure for insomnia, there seems to be no space to query the plan's aim to do more with less, a quote from the plan, by moving services out of acute hospital provision. Save Our Hospitals is not opposed to either illness being prevented or to patients being treated in the community. Who could be against this? But in the context of major cuts to both health and social services, we do query how feasible this is. Which brings me to the question of evidence. As the NHS England engagement document says, service change must be evidence-based, and this evidence should be publicly available during the consultation and decision-making stages. Save Our Hospitals has been calling for the evidence base for shaping a healthier future for 4 years and has yet to receive it. The STP is simply a revamped version of Shaping a Healthier Future, which continues to provide no evidence that the proposed changes can reduce the need for acute hospitals, thus justifying the downgrading of Charing Cross and Ealing hospitals, let alone that providing out-of-hospital care is a cheaper option. Where, for example, is the evidence that overstressed GPs can take on more work, however organised, without an increase in the number of GPs in North West London? Where is the evidence that the pilot programmes, many of which are still ongoing exercises, can substitute for acute hospital care when there's population growth and when hospitals at present are overwhelmed by patient need? I could continue page by page. I have a lot of notes on my desk, but I won't. Essentially what I am asking for is that you follow NHSE's instructions for proper consultation, where the public can view the evidence and make informed decisions on the adequacy of what is proposed.
Start off picking up that and then like fill that out to others. So I think there were 4 key points in there. So there was a first around cuts and sustainability. There was a second around engagement. There was a third around the evidence base. I think the first two together, cuts and sustainability, evidence base and engagement, I think were the points that I heard. So the first thing in terms of the money, we will have, the NHS budget is growing, so unlike social care, which has been subject to enormous cuts, and we would absolutely recognise the problems that has caused for social care and the impact that that's had on health services, but the health budget is going up. So it's not that we are looking to reduce the amount we spend on health services. The problem is that demand for those services is increasing much faster than the amount of the budget that we've got. And what we are seeing, and which we have no control over, is that total NHS spend is reducing as a proportion of GDP, and that clearly makes it much, much more difficult to continue to deliver services when we know that the population is growing, demand for services is growing. And Tim quoted some figures earlier where we were looking at sort of 13%, 15% increases in the numbers of people with long-term conditions or learning disabilities, who are the ones who are the users of the greatest number of our services. So when we talk about a gap, and the 1.3 billion gap we're trying to close, that's the gap between the amount our budget is growing and the expected demand for those services. So what we are trying to do is to effectively either reduce that demand by helping people to stay well for longer and preventing them from needing those services, or we're trying to reduce the cost of the services that we're delivering, so that through that combination of delivering services more cost effectively and keeping people well for longer, we can close down that gap. Clearly this is a massive challenge. I don't think anyone working in the NHS nationally would not see this as a huge challenge and much greater than we've faced previously, because this is also going on in an environment where we have innovation in medicine, that we have lots of things that are meaning that we can treat more and more things than we've ever been able to treat in the past. And that leads into the sustainability point. So at the end of the day, there are only a certain number of doctors and nurses and other trained healthcare professionals in North West London and nationally. And we see lots about overseas recruitment, but the truth is there are still very high vacancy rates in the NHS. So to make our services sustainable, we need to be able to use those most effectively. So doctors only seeing patients that a doctor needs to see, and using nurses where nurses can treat the patient, using healthcare assistants where they can be working with people, particularly maybe with long-term conditions and so on, so that we can make ourselves sustainable. And we believe, and I recognise not everyone else agrees with this, but we believe that to do that, we do need to consolidate our acute services into a smaller number of places so that we can get round-the-clock, 7-day-a-week care, so that whenever you turn up to hospital, you will get the best possible outcome. And we recognise that that's controversial, and I think there are lots of points that we agree on, and that was clear when Councillor Cowan spoke earlier, but we recognise that's the key one where we disagree. But that is the view of our clinicians, and that's what we're trying to achieve. So we are trying to balance the taxpayers' money that we are allocated as effectively as possible to meet as many needs as possible. as has been referenced before, a lot of the plan is based on shaping a healthy future, and we did do an extensive consultation around those plans. We did an extensive consultation around those plans. The case for change within that supported...
slower, because it's like...
Sorry, I apologise. So the case for change was supported by the majority of people who responded to that consultation. A lower proportion of people agreed with the outcome in terms of which hospitals that might impact on, but the case for change was widely supported by the people who responded. We recognise there is not a lot of...
That's not so. I think if you look at the Mansfield report, it points out that consultation on shaping a healthier future was inadequate. It's a bit like your current online consultation about this, which actually doesn't allow you to raise major questions. You simply prioritise what you have chosen to be the issues. That is not consultation.
And that's not intended to be consultation. We have got a range of ways in which we are trying to seek the views of the public. This is one of them. This is absolutely not the only way or the way we need to do it. And in terms of how we develop services, we do involve service users in the way that we develop services. We do engage in as many ways as we can. We always recognise that there is a need to do more engagement, and we will do that. The consultation at the time was reviewed and was certified as being a good consultation by the Consultation Institute. I recognise that there are differences of opinion on that. But we do hear and absolutely recognise that we need to do more to come out and to talk to people and to get input into the decisions we're making and get input into the way that we are designing services, and we want to continue to do that. I just want to pick up the evidence, or maybe hand over to Tim to pick up the evidence points, and then I'll come back to other
just
points.
a bit about evidence. But just before, I don't support, and I know we're going to disagree, I don't support the idea that this is shaping a healthier future dressed up. And Stephen and I have been through this for years and years, and I was involved in the primary care trust before the CCG, and worked very closely with the council at that point to integrate health and social care. And I think when I look back on the documents about shaping a healthier future, there are lots of things that the STP says now that weren't even in the mindset of shaping a healthier future. So support for carers, dealing with social isolation, the link between mental health and physical health. There are lots of things which all have a good evidence base, by the way, that actually the agenda has changed in that 5 or 6 years, and I think I think the STP is dealing with a more important set of issues in a better way than shaping a healthier future did. And I've been a medical director of shaping a healthier future from the outset, so I feel I can have a view on it. One of the things that shaping a healthier future was based on was the evidence about grouping together how stroke services were delivered across London. And there is good evidence that that saved hundreds of lives. And I only say that because my example about testing somebody to see if they've got an irregular pulse, for which there is a very good evidence base, and we can share that with you, will, if it's introduced across London, save thousands of lives, because it's actually, if you actually deal with this irregular pulse and have the right treatment, you prevent strokes, you prevent heart attacks. It's a very solid evidence base that means, why is there more emphasis on dealing with long-term conditions in the SDP? Because we do have that evidence base. The other bit of evidence that I think we cannot shy away from, and as a clinician I cannot shy away from, is that every time we do an audit of our residents in acute facilities, 3 in 10 of them do not need the acute care that the hospital provides. It's not that they don't need care, they need to be cared in a different way, in a different place. And I think that the SDP is an opportunity, and we can evidence that. I think the opportunity is there are better ways to help and support and meet people's needs that aren't always an acute hospital bed.